Just to close these opening remarks, we would like to give the floor to José del Carmen Sara, Viceministro of Public Health. Sir, you have the floor. Thank you very much. And I would like to greet my colleague, Vice Minister Tolmos, who is leaving, Dr. Francisco, Dr. Villanueva, and our host, Luis Fernando Leanes, our friend, together with his team of the PAHO in Peru, and the UN agencies that are here with us, the different stakeholders of the Ministry of Economy and Finance. And I also understand that there are officers from the Ministry of Women and Vulnerable People, vice ministers, different public institutions, different agencies, Maternal and Child Health Institute, as I mentioned before, the UN agencies, UNICEF, UNFPA, the Ombudsman's Office, and the different organizations, civil organizations, which are not just observers, but I would rather say actors and even starring actors of what we are going to review in the following days. We were saying before the start of this meeting that the design of this meeting has an interesting conception. The first day, we will identify the different success factors that have allowed Peru to carry out progress in the objectives, in the Millennium Development Goals, which are specified in terms of nutrition, reproductive, maternal, newborn, and child health. But there is a second day which aims at identifying the critical aspects, the reasons why the road taken does not please us Peruvians. And in this work, the role of a different civil society organizations, the care for other forces that have been working as actors of this effort, realize that it is not an accessory work, but it is a steering role. And we, as the Ministry of Health, recognize and thank this work, because many times this forum has placed emphasis on the agenda in order to make progress. I see that we have scientific organizations here too. This is very important for us. The pediatrician, obstetrician, gynecology areas have provided their contribution from their own areas, not only for the practice of their work, but with the proposals. First of all, I know that most of us have been living in Peru for many years, but I know that there are other people which are looking at our country with high expectations and are trying to collect successful experiences in order to repeat them in other countries. We're fully aware of the situation. Doubtlessly, there are many things that we can export, and we are aware that we have limitations that we must identify and which we know about. Just to put this information into context, we were talking to Dr. Del Francisco. As a country, this is a very precise thought, because it does not happen at any time in our country. It is not any point in time, but it's a specific point in time in the history of our country. And it is important to stress that this point in time of the country obeys to a decision by the Peruvian population, which in the past election found itself in a very singular situation within the Americas. Peru boasted about having a most promising economic development. But suddenly there was a whole alternative for the population to choose among political groups that wanted to access the government, that wanted to achieve economic stability, and others that had the flagship of social inclusion. And it is interesting to note that disability situation, which proposed a choice for the population, realized that there were some inequality elements that were not compatible with sustainable development. So the country made the decision and chose to identify government alternatives that were proposing social inclusion. And this is a message by the population, and therefore this Peruvian government mandate cannot be left aside. And therefore this government came into office, and it has made a very significant effort in order to care for the basic elements of social and economic development. Obviously, without economic sustainability, there is no way in which we can grow. However, it is very clear about the mandate of the population with respect to social inclusion. Therefore, the creation of the Ministry of Social Development and Inclusion, this initiatives to strengthen this program, and this is also an important element for the Peruvian government. We believe that the Peruvian government has shown us a degree of maturity through the respect of the initiatives that have been carried out up to date. Usually countries like ours tend to reinvent everything at the start of the term in office. But lately, there are many policies that have been started by former governments and that have been maintained and strengthened by the new governments in office. Different initiatives which have sought to help the government come closer to the population as a whole. And doubtlessly, these initiatives within a social inclusion mandate had to be sustained and obviously strengthened. The health sector has not been an exception. I wouldn't dare to say that it has been the most important one, although we are aware that our responsibility is totally relevant. But the government has made different efforts in different sectors, which is good, but I do believe that among the lessons learned, it is not enough. Furthermore, it is not efficient. The Ministry of Economy and Finance has made significant efforts some years ago to develop money transfer strategies through results-based budgets to generate elements to decide to allocate budget against results. But this was not enough, I must say. Although it is true that significant progress has been based on these efforts, those of us who've had experience in the work as intermediate service providers will realize that there are mechanisms to use this budget in other ways which do not reflect the actual result. Condition transfer are addressed to families or people with very good intentions. However, sometimes they disrupted some poor families that were trying to have more children in order to receive greater benefits, or were trying to disguise themselves as poor people. But this was not enough. In the health sector, an important policy has been promoted, a government policy which is health insurance. This was not an idea of the former government or the one before that, but this was born from the National Accord, which included the work towards universal health coverage, starting with the poorest populations and going bottom up. And this was supported by 3 different governments. And based on this topic, we have achieved greater health coverage. Today, under this social inclusion mandate, we have managed to break this barrier, saying that health insurance should be aimed at the poorest population or extreme poverty population. In a country where half the population is poor, it is completely reasonable to start down there. But in a country which is reducing in poverty percentage, the idea would be to release the government from its role as a... But this is not the case. The government is given significant steps to say that they were privileged poor people, but would expand this conception so that in order for them to access to this insurance policy, we can only include vulnerable population. For example, elementary students, people under the age of, children under the age of 3, pregnant mothers. These are very clear political elements which expand coverage not only to poverty situation people, but people under specific conditions, which open the doors of public health to diagnosis and treatment to people. Insured people are not only the most poor people in the country. We need to be blind to notice that what used to be comprehensive health coverage some 5 or 7 years ago, where we included pneumonia or diarrhea or other kind of issues. However, with this new plan and the complementary plans, and with the participation of high or expensive diseases, this comprehensive health coverage covers all kinds of diseases. So this coverage does not provide second category services. We believe that this is not the right approach, but let's not get distracted around these topics. I just want to mention that each one of the sectors has made specific efforts in order to try and sustain and strengthen those actions which, from their own field of action, help to enhance these indicators. So we believe that one of the most important lessons learned in the past 2 or 3 years are what we see today with enthusiasm. Maybe I am more enthusiastic from the Ministry of Health because within the framework of the health sector reform, we have reorganized functions within the ministry with a new law of organization and functions. This has marked a new division that may seem a bureaucratic division just to benefit more people from some specific privileges. However, for those of us who have been working in the health sector for over 35 years, specifically for me, who is acting as a vice minister for a second time in 2 different governments in office, it is instrumental, it is fundamental, because just some months ago, as Vice Ministry of Health, the Ministry of Health and I had clearly identified the mandate provided by the government for health care. However, as Vice Ministry of Health, it was inevitable that 80% of the time allocated, which may include 18 hours, 20 hours of work, were focused on complaint, malpractice, salary demands, etc. So many problems regarding the provision of services. What the population understands as health is just having a physician in the different towns and receiving medicines, and this is correct, and this needs to be responded to. However, these efforts were consuming the efforts made by the Ministry of Health. However, year after year, and this is something I told the minister, when she asked me which vice ministry I wanted to work in, I pointed out that although part of my professional life had been engaged in health insurance, I would dare to say that the Ministry of Health Insurance would be the easiest one for me. But what we need to inform about to the Congress is about maternal and child mortality, etc., etc. So this is something that the ministry did in its spare time. I should not be saying this, but I must say that there were heroes, coordinators, strategists, directors who had this task and who supported the work in yours, the international organizations, civil society organizations, etc., etc. So I was really enthusiastic to work in this area. The Vice Ministry of Public Health is important. It used to be divided. Its function was divided in one Vice Ministry of Public Health, which work is to work in these lines of public health, which are the reason for the existence of the Ministry of Health. This allows us or forces us to generate some actions which are really demanding. Now it's harder to get an appointment with me. I am fully aware that my work must not be centered at the Salaberry office, and I spend much of my time traveling around the country rather than sitting in my office. And I am fully aware that the actions taken by the Ministry of Public Health are with MIDIs, with the Ministry of Economy, with the Ministry of Living, with the Ministry of Housing, with Ministry of Education, Justice, Development, etc., etc. And beyond the SIAS, as Dr. Tolmos mentioned, we have built an awareness of change of mindset, of opportunity, which is being shared by the government as a whole. And we consider this an opportunity. These different efforts in the different sectors would not work if they are not built into packages of intervention where all of us work together as a government through new incentive elements, European work, the fund for the encouragement for development. That means this is trusting has this European logic, the comprehensive health insurance is promoted per capita governance, because before the government paid for the number of patients. So the larger number of patients or the more effective the services, the hospitals receive more money from the health insurance institution. And the small public health facilities would receive low amounts of money for 1 month of work. So we generated the per capita payment where we reimburse according to the number of insured people through the primary health networks. And the indicator, in order to pay them more or less, were sanitary indicators: vaccination, immunization, malnutrition, health, mortality, etc. So this is what we started with 5 regions, but today every region has per capita agreements. The country will carry out the achievement of indicators as incentive, not to reward the hospital, but the actual worker, the healthcare worker, an incentive based on performance linked to the result of sanitary indicators in their jurisdiction, linked to the fund for the development, which is actually given to the executive unit, and this helps to reach these objectives. But these are the objectives. It is a mistake to believe that the objective is the instrument, because if that were the case, it would not work. It's only an instrument. It is a tool, as the C's, capital, etc. These are all instruments, tools. So, just to wrap up, it is a very singular time for our country where we are anxious to work, we are willing to listen, even if you don't think so. We are one of the things that people think is that they believe that the ministry has the solution. However, we actually need to hear from you. We want things to be different, as Fernando said, because that is our call as health providers. This is a mandate that the government has received by the Peruvian government, and therefore this plateau, which has been reached, if it were homogeneous, if it were standard, we could be comfortable. However, this is not the case, and you are very aware of it. This plateau hides significant gaps, and this plateau hides a reality which is equal or worse in different areas of the country, or for some groups, population groups. So, through all of you, you are the new army, and that's how I call it. The advantage is that my army is not just nurses and physicians who will sometimes go on strike, but the new army for public health is majors, regional presidents, community leaders, civil society organization. Finally, WHO says that working for health does not mean just fighting against disease. That's what physicians do in hospital. Actually, working for health means working for the welfare of the population. Those people who actually want people to have access to the right is a health worker. Therefore, it is part of the army for health with which we aim at reaching best results. Thank you very much.